A civilized meeting on health care reform in San Francisco today. That hasn't always been the case around the country lately. House Speaker Nancy Pelosi told a small crowd here today that this is the opportunity of a century and there is no backing down. ABC 7's Carolyn Tyler is in the newsroom. And Carolyn, the Speaker certainly talking tough.
Yeah, pulling no punches. The Speaker says the President is committed to a bipartisan bill. But if that's not possible, she says there will still be a bill. Those who gathered with her today called on a higher power to persuade Congress.
It's hard to change. But it hurts when it's your child or my child that can't go to that hospital and get some help.
You could say they're praying for health care reform. These ministers, rabbis, and other clergy were brought together by the San Francisco Interfaith Council and the San Francisco Organizing Project.
In my Jewish congregation, really what we want to say is a public option, a public option.
The public option is the White House plan for government-run insurance designed to compete with private insurance companies. That idea has become the focus of the health care debate. Today, House Speaker Nancy Pelosi indicated, contrary to some reports, there will be no retreat on that issue.
Are you talking to me? Caving into the far right? Let me say it another way. There's no way I can pass a bill in the House of Representatives without a public option.
She was asked if the president is beginning to backpedal in the face of opposition.
No, he isn't. He isn't at all.
But there are many who wish he would. Protesters gathered outside a town hall meeting in Chicago today, where Vice President Joe Biden and Health and Human Services Secretary Kathleen Sebelius talked health care reform.
Why do we need Big Brother? Why do we need somebody in D.C. telling me in Chicago that I need this or I need that?
It's not clear that it's going to solve any of our big problems.
Stanford senior fellow Alan Inhoven is known as the father of managed competition. He says health care reform is urgently needed, but the White House plan is not the way to go.
The trouble is with the public option is I think it'll look too much like Medicare, and more now people are coming to realize that fee-for-service is not the way to pay doctors, that pays more for doing more things for volume rather than for quality, doesn't pay for better outcomes.
Pelosi says she has more than enough votes to pass a health care reform measure in the House, but the battle is likely to be much tougher in the Senate, where conservative Democrats as well as Republicans aren't on board with that controversial public option. In the newsroom, Carolyn Tyler, ABC 7 News.
All right, Carolyn.